So anytime you experience a burn, there's been a lot of heat or chemical, the variety of ways that you can get a burn. Even in a situation where you don't have to do surgery, the injury to the skin creates inflammation. And with inflammation eventually comes fibrosis, or the formation of sort of fibrous tissue within the skin and the tissues underneath it. As that happens, it hardens, and then ultimately is a loss of tissue. So it ends up being a little bit tighter as a consequence. The essence of a burn scar is a situation where you don't quite have enough of the soft tissue, the skin and the underlying normal soft tissues that are there. And so it's all about tightness. What happens when the skin is a little bit tight and you attempt to move in your normal fashion? You're going to have, when it's pretty severe, a limitation of your range of motion. And there are situations in the hand, for instance, where your joints have an abnormal posture, where you can have different deformities of the hand. And this can happen really at any joint where you just cannot move in your normal way, or you can even be held in a posture that's not normal. Another possibility in the face, if you have a deficit or you don't have quite the tissue that you need because of the tightness of the contracting burn scar, the eyelids can be pulled down. You can really have a tight deformity of the face where the eyelids can be affected, the mouth can be affected to the point where you can't even drink quite normally or have a full range of motion. There are a couple things about the burn scar that lend themselves to being modulated or treated and made better by laser. One is if you have a lot of inflammation leading to hyperemia or high flow, just red, angry scars, that's one thing. But then the fibrosis can be changed as well. So there's an array of different lasers, some which are tuned directly for the redness and some of the inflammation. And then there are others that are intended to break down and soften some of the fibrosis or the scarring itself. And so we mix those, we use those, and we adjust those specifically for the scars that the patient has. And we don't have to wait so much, and we're able to get things to soften up earlier that way. So it's been really helpful. In order to really understand what the possible treatment options are for scars, you really have to remember the fact that scars represent, number one, inflammation, but also, in most cases, a deficit of tissues. And what I mean by that is, in comparison to the normal healthy body that is pain-free and moving with no limitation of range of motion, in the case of the burn scar, it's just not quite enough tissue, actually. Sometimes it's severe enough that you just need to add tissue. There are other situations where it's not quite so severe. You don't have to add skin. You don't have to do something quite so invasive, where laser alone can soften up those scars. It can change the quality of the scars themselves so that they soften and feel a little bit less tight. There are other situations where things are just so tight that your body is just not as healthy as it could be. Range of motion is limited, or there are even some patients whose chest is so tight from their scars that they can't even breathe entirely normally. And so that's a situation where reconstructive plastic surgery for these patients is really helpful, because what we do is, number one, we release the scar. And so we make incisions surgically to allow the body to adopt its normal posture and its normal range of motion. So there's the releasing stage. And then during the same operation, we provide the additional tissue that's needed in order to maintain that. And sometimes that requires grafts or sometimes flaps. There are very kind of subtle but important technical differences between those two. But the bottom line is, we need to A, release, and B, we need to provide the tissue that's missing. There are patients for whom a considerable hospital stay for a big reconstructive operation that's really going to give them a lot is worth the investment and loss of time, in which case there's a longer recovery of weeks to months even if they need just a lot of tissue added. But that's really unusual. Most of our patients are outpatient, where they come in and, for example, from a laser, it's in the range of days, just a few days to a week after the initial laser. If it's carbon dioxide laser, for instance, it's a little bit on the longer side. If it's a pulse dye laser, which does not actually create a wound, then just a little bit of bruising, and they're up and at them almost immediately. There are other situations, but we individualize them. But the vast majority of our reconstructive patients are able to come into the hospital for day surgery and head home and are back at it really quickly.